Thank you for doing this.
Yeah.
Really
Are we
appreciate
rolling
it.
right now?
Yep.
Oh,
I
great.
just go.
Oh, I love it. Yeah.
I don't, we cut straight into it. Oh, we really appreciate it. I really appreciate you. I've gotten to know you quite a bit over the past few years. And of course, we'll talk about it in terms of what you do, but Cumberland Heights is a customer of yours.
Right. Partner. We like partners.
Excuse me, partner. Yeah. But I just want to say a shout out to you because really doing this here at this event at the Global Exchange was partially your responsibility.
Well, I hope it's been fruitful or helpful.
It's been great. We brought Nashville to Orlando.
I got to say, I don't even know how you did that back there, but it's fantastic.
I didn't do any of this.
Yeah.
Just FYI, so it's a great team. They set everything up and, just to be transparent, because it's not a negative thing. It's just, it's tremendous value for us in terms of introducing people to the real human beings that are in this field.
Well, grateful for the opportunity for me to be here to do that.
To be one of those human beings.
Be one of those human beings. But I'm glad you're
introduce yourself. Tell us who you are and what you do for work.
So there's so much to say about who you are, right? Because it's just such an open thing. I'm a human being, I guess, Trevor Colhoun. I've got two boys, a 12 and 14-year-old boy, single father. I live in New Orleans. I grew up in the Yankee world of Connecticut, but also spent a tremendous amount of time in childhood in California. So I've got a bi-coastal thing going on, and now I'm on the third coast in New Orleans.
Nice.
But I am not a healthcare person, even though we're in healthcare. I guess we all are healthcare people at some aspects. But my entire professional career has been in either investment banking or private equity in the tech side. And then I moved into operations probably about 10 years ago. I'm a people person. I really love people, which was a hard thing for me to admit. Because I got a little bit of an introvert in me, but I love being around people. I love the energy of people. I also love working with those people and solving problems and looking at what the root of a problem is and how to solve those problems. And that's really what attracted me towards the mental health, behavioral health business, because we got some problems.
Yeah, sure.
We got a lot of structural problems. But that's who I am, I think.
And tell us the project that you're spending most of your time on.
So the only thing I'm doing right now professionally for the last 5.5 years has been TPN. And we, through the process, look at the entire industry of what the issue is, and it's a big elephant. But the issue of behavioral health is that I'm a user of behavioral health services, yet I don't understand the value prop of behavioral health, right? I don't understand if I pay for it, I see a clinician, how long I need to see that clinician, and then when do I get recovery? And it's not innately known to me as a lay user how to approach this market. And that exchange, right? And I think that I don't think, and you know this well in terms of the data and outcomes work you do, it's difficult to articulate the proposition not only to the end user, but maybe even the payer, right? The capital pool side of the business. And when you also look at the aggregate data, we have 75 million Americans that need to engage with the behavioral health market, and only 20% of them engage. And that's not because of stigma, and it's not because of access. It's really this value prop issue. And it's something that we need to solve quickly. And I'll talk about kind of how we're approaching that, but it's something we have to solve quickly because the demand is growing exponentially. Wonderfully, the job market, so the clinical market pool is going to be growing as well. And the supply of capital coming into this market is going to grow, especially legislated by the executive branch on September 8th, where they just created rules based around this parity law that's been forever, where, if I'm an employer, I've got to spend the same amount of money on mental health as I do on physical health. And that's a tidal wave, right, of demand coming to this market that this market isn't ready for.
So in the simplest terms, tell us about TPN and the structure of this business and how it's solving for access.
So we see the most important, variable in behavioral health is the individual clinician, okay? And the individual clinician understands if you're diagnosed with this and they're specialized in this modality intervention, that they can get you to recovery, whether they're DB skills or EMD, whatever their modality is. The issue for the clinician is they're analog and bifurcated, and they're siloed and they're in little pockets, and there's no connective fiber. And we are recognizing that if we can get the clinician on a marketplace dashboard, think LinkedIn, that they can start driving the bus of recovery instead of, I'm going on Google, my daughter's having issues with XYZ, I need to find therapy, I need to find, acute care treatment, and I'm driving the bus without having any knowledge. What if I had a care navigator, a clinician that has access to that data and understanding, I do this intervention, I do this modality, I take this insurance, I'm in this network, I'm available, I speak this language, I handle this demographic, so on and so forth. So really creating the digital infrastructure of behavior health, the real aggregation of those individual clinicians holistically, right? And that's really a marketplace at the end of the day, and starting to understand value and the pathways of how to navigate this place. You really look at it, the physical market has solved that. I go see my primary care provider. They go refer me to, an oncologist or whatever I have to, whatever my issues are. That's not the process in behavior health right now. Now, how you do that is a little different, and that kind of comes to the business of TPN, is we've really figured out how to allow organizations to connect and engage with clinicians at whole, whether they want to connect them because they want to build brand, whether they want to connect to them because, for Cumberland Heights, I want to train my 300 clinicians on staff, or so on and so forth. We've created, technology about how to scale continuing education and leverage continuing education to be this nexus point to aggregate this entire space digitally. And that's brought us to a point now where we have 45,000 licensed clinicians on the platform. Those clinicians lean on us regularly to just manage the minutia of their licensure process, whether tracking their license, whether maintaining their license by receiving continuing educations, or even elevating themselves to have further knowledge of a modality intervention or a course or stuff like that. The result of all of that activity, right, is this connective digital fiber where they can start seeing pathways on where it is. So instead of having just having, you as you maybe my client saying, I need a referral, me handing you a paper of 5 people and saying, well, you go call them and find out. We could digitize that process.
It's interesting and compelling. I have 2 things. So at the end, I'm going to ask you a hard question.
Good.
I want to talk about our Cumberland Heights' experience with TPN for a moment, because I guess compliance, CEU management. So one of the things that I had to learn very quickly when I adopted a new team at Cumberland Heights was how we were managing CEUs and how that process unfolded. And because we're the age we are as an organization, it kind of makes sense as to where we were, which was having direct contact with national agency or local state accrediting body to submit the CEU credit for approval. And for those that don't understand, LPC is different than MFT, which is different than LCSW, which can be different from clinical psych, which is different than medical.
Yeah, those are all 5 different boards.
Right.
Yeah.
And the answers to the questions are different in terms of how you submit the description and the learning objectives and the resume. And so not only is there a financial component where you have to subscribe to be able to do that, you have to have staff that are actually submitting documentation, maintaining communication, and then making sure that everybody that's signed up is getting the said CEU distributed to them afterwards. I mean, it's especially if you're having an event, we're trying to have events where there's maybe 100, 150 people present. That's a lot of work. We first partnered with TPN because TPN automated that process for us. And it worked well in terms of you're the one-stop shop for us to submit all that documentation. You guys manage that entirely. And there was some other interesting digital advantages, technology accelerants, where we could make some of the content asynchronous if we wanted to. So it solved for access and distribution, and to be honest, sometimes a lot of error, and where the choke point was of the paperwork or the certificate didn't get delivered. No, all of that kind of went away. And our current staff development coordinator, shout out to you, Caroline, because she's busting her tail. And her and Stacy Bridges are really the two primary stakeholders. Yeah. Caroline manages all this trainings for our staff internally. And, she tells me all the time that she loves it because it took all of the Excel work that person was doing and basically transposed it into TPN. And I know that our staff too have benefited because not only do they have access to our trainings, it's everything else that's in the platform.
Yeah.
So here's my hard question.
Okay. So excited.
You're probably going to be like, softball. How is TPN different from Psychology Today?
Yeah. So Psychology Today is a directory. It's not a network, right? So,
what's the difference?
Huh?
What's the difference?
So a network is interconnected, right? So I can actually, if I come on TPN, I have my own user account, and I can connect with other clinicians. I can endorse them, refer them. You can still search on a directory, and that's where directory kind of ends. But it's really the data, right, and the process where it advantages organizations, right? So we know when someone's in the platform, we know who they're connecting with. We know, who they're connecting. What kind of continuing education they need. So when you start thinking as a treatment center, I want to build a brand. I want to hire somebody. I want to. So many. You can't really have those connective things. You can't have a Shopify aspect for, if that makes sense, on Psychology Today.
There is a dearth. There is a lack of digital spaces. Here's a concern that I think I'm biased.
Yeah.
I'm a clinician. I'm in recovery myself. Yep. I've worked in this field my whole adult life. Because of all those things, which is quite an investment, I know how to make referrals to trusted providers.
Right.
I know how to self-select treatments. One of the things that intrigues me about the future of TPN is really going all in on the idea of, hey, we're going to create a digital space, a new digital space for people to make informed treatment decisions.
Yeah.
I'm all about that. Because there is a lack of an ability. Anybody can throw a website up and make it look really great.
Yeah.
Again, that's partly why we do this. It's no, I want you to, we want you to hear from
you want to show your insides out to the world.
Correct.
And be authentic and have integrity about it.
Correct.
That's what,
It's easy to make a cool pamphlet.
Right.
It's easy to polish a video.
Right.
We want that exposure.
You want to show your
inside
clinical,
out. Yeah. And one thing, again, that intrigues me is just, I wonder how TPN, for lack of a better term, can take advantage of that.
Oh, well, thank you for that. That was a softball. Well, one thing that Psychology Today is, and I'll get controversial, is I've got a target on them. I don't think they deserve to exist. because they're essentially attacks on the industry, they're attacks on the clinician, and they're reiterating this function of the consumer's driving the process without any knowledge of how this works, right? The clinician should drive the process of recovery and have the information and data to move a client through. Much like that thing is you understand the referral process, but what if you can get data on understanding, have transparency and comfort of the integrity of the data that, yeah, this person's licensed, they are credentialed, and Sally Smith, who's a social worker in Nashville, Tennessee, has endorsed that person, right? That kind of gives you clarity. You can see who else they're connected with. Have a professional driven digital platform. Okay, so that's really the ethos of TPN. We will open up TPN, which might not be understood as this is a closed B2B network, right? If you're a clinician, you can get in and you can see TPN. If you're, Johnny come lately and you're looking for therapy, you're not getting access to TPN. And that was a strategic thing we started from the beginning to really build the integrity of TPN. Now we've kind of gotten to scale. We're going to open up TPN to the public. So they can come on and they can see Cumberland Heights, or they can see this clinician and understand, but they can also see Cumberland Heights from a different angle and understand, wow, this place has 300 clinicians or whatever the number is, and they are very clinically driven. And they are endorsed by, this group or that group. We don't really value endorsements from a consumer. Not that we don't respect the consumer, it's just that they're not the professional to understand, because you really don't know, they went to the place and they had a bad experience. Was it because of the clinical space, or was it something with them? And we've now given them a voice to just to create that's not valuable to the clinical process. And I don't think that there's, unfortunately, I don't think there's value to that voice.
That is interesting. I suppose it hasn't been top of mind for me that TPN is about to go public in the sense that they'll be exposed on the web.
Yeah.
And families obviously won't have to log in like a clinician does, so to speak, and be able to search.
They'll be able to search and see who's out. And it also adds a value to...
Gosh, Trevor, how are you going to balance... Sorry to cut you off.
Yeah.
How are you going to balance... are you going to let organizations create ads?
That's to be solved. That's not open at all. But that's to be solved. There's ways of great technology of measuring that's autonomous from kind of a human capital touch to see. I think what's important to us is that treatment centers will be valued on the function of the people that they're in and not the bricks and mortars and palm trees that they have.
Yeah.
So I have these licensed clinicians. They're scored this way on aggregate on their performance, and there's several companies that we're talking with and looking at to help us out. But for right now, we're not going to allow advertising, because that opens up some Pandora's box, and we want to be ready for that. Right now, what we're doing is, you're a treatment center. We're lightly vetting you just because on your reputation and what you know, and you're getting invited into the platform, and you're allowed to like. If you do 12 events on TPN, we'll put you in front of 12,000 clinicians in a year, and you'll get 87 minutes with those people. There's no one else that can do that. People go to conferences, they're going to this conference, and there's over 1,000 clinicians here. But if you're having a booth downstairs, you're getting in front of, 15 clinicians and having a wonderful touch point,
Preach.
Right?
For real.
What's the value of that? Is that
also, to be honest, to be really and I'm a little
let's get controversial.
I think we're both real introverted brothers a little bit. I can go we can go talk, but then later I'm be I'm done.
Yeah, it's a lot. It's an energy.
That's what I'm saying. It's a lot.
It's a lot.
Conferences aren't a place that just me, not my organization, but it's not a place where I go.
I'm not surprised by that, by the way, because you're a thinker. So it's not,
You have to turn it off.
Yeah.
But it's not a place where I go to learn about a new treatment center.
No.
That is something that'll happen maybe at a training in Nashville.
It could happen at a training and
or
a
visit. Digital space.
Yeah. Or, what's great is, one of our, like Sabino, who's a great partner of ours, come on, do a training, and then you get to understand kind of their clinical internal side. And you're like, God, that's very interesting. They're doing, let's create a vehicle where they can present the actual work they do, and not the fact that they have shiny brochures and websites and palm trees and stuff like that.
Yeah, and it's,
Let's make this a clinical process.
right. Which, well, I won't go down that road, but, we're making intentional decisions at the events that we show up at, and this one is like only one of 2, 3 national events that our organization is coming to for a reason. Yeah. Well, I just want to back up a little bit in terms of the advertising. Yeah, I would love to talk to you about that more because, it is real disappointing. And I've talked to you off about this before, but it's real disappointing. Google's the number 1 search engine in the world.
They make over $8 billion a year, and that's 2 or 3 years stale in terms of.
And it's disappointing that there is not clarity in the presentation of misleading ads looking for a place like Cumberland Heights that rank above us. And
right.
There's a lot of things happening behind the scenes right now, but it's
by the way, that's not going to change.
Right.
That is not going to change until some other process comes in, and we're the process hopefully that changes that in terms of I want to go to a place that has integrity and ethics, and not saying they don't want that.
Yeah.
People want that, but it's a process of how you do that. I can't go to anybody and be like, you're doing something bad and you have to do that. And you're like, yeah, well, what can I do? I need to keep the lights on and I need to fill my bed. So we're trying to present a process where you can have a clinical driven process to actually fill your beds and connect with clinicians who will actually see you as a potential referent to send their patients to.
That's an interesting challenge. I appreciate you pushing back on me on that. Like, I hear what you're saying. I don't know if I agree with it yet.
We're a new idea.
No, not TPN. Yeah. I'm talking about like an organization like bidding on somebody else's likeness to feed off of their brand to get people to come to they might be still identifying themselves as Nick's Treatment Center, but they're hanging their shingle next to ours to try to...
Yeah, they're trying to get some of your shine.
Yeah, of course.
Yeah. And that's going to, the Google process
that's not going to go away.
That's not going to go, that's their business model. That's how it's all set up. And it works in other industries.
Shop at Staples or Best Buy. Here's an ad.
It works there, right? And they transferred over to the mental health side and it doesn't work.
Okay, so let me ask you this. What barriers are in the way of TPN from being able to accomplish this goal that you can see right now today?
I think the biggest barrier for us might be over in terms of just access to capital and proving this out. We started in Louisiana, where we're based in New Orleans, and we have a 75% penetration rate, meaning we have 75% of the clinicians in the state on our platform. And we are now moving into New York, California. We're next largest is Texas. We're about 4,500 clinicians.
Is that how you're going basically?
We're focusing state by state, and we're in every state.
Right.
At size, but being intentional.
Right.
Colorado's another state we're being intentional about, where we can bring tremendous access. And I think what we are is really an unfair advantage if you're a treatment center and you're trying to grow or build a brand or build a referral network is who do you want to connect with, right? You want to connect with a clinician so they know professionally who you are, and you build a relationship at scale and build a funnel with those clinicians to start thinking about you, treatment center, as a resource for them, for their clients.
While also automating CEUs and while also consuming great content. It will have to reach a few, to be frank, again, like from a marketing perspective, we're concerned with Tennessee.
Yeah.
That's our primary focus is that community. There's always people from the bordering states and anywhere else that can
Kentucky
access our services. Yeah. But I guess what I'm saying is we're not spending resources in California.
Right.
And I'm wondering, ideally for TPN to be successful for an organization like Cumberland Heights, there has to be a fever pitch of participation with the clinicians in that state for it to be like a huge advantage.
Yeah.
I hope that happens.
Well, there's tactical many ways to do that. So we're a partner of American Psychology Association, American Council Association, so they all have arms in different states, right? So you partner with that arm and their membership as you attach yourself to them, and that's one way to attach. You put on events that are just focused on that state, and go from there. So there's many ways to just connect with those.
And I want to say this too, So on behalf of Cumberland Heights, we appreciate TPN.
Grateful. And we appreciate you guys too. You guys have been a great partner, great development partner.
That's true. Yeah, we've been we had meetings.
Yep.
But what I was going to compliment you on, Trevor, is you're always willing to compromise, and everybody in your staff has always been willing to. I think it would be hard for me to work for to not work for a provider, because providers like it their way.
Yeah.
And you guys have always tackled our requests, our discussions and conversations with understanding and grace, and tremendous customer support. Of course, there's always this, that, or the other,
Yeah.
but like for the most part, like 95, 96, 97%, it's been a tremendous partnership that we've valued. And we're all in on you solving these issues, man. And appreciate you helping us by way of your connection to this event, kind of like brainstorming ideas to do this, to take advantage of, being here. And yeah.
Well, I'm grateful you say that. We don't know anything, right? And none of us know. So we want to make sure what we're doing is helping you achieve your goals. So we've learned a lot from you guys in terms of we can have an idea and a thesis of how this should work, and then you kind of mold it into the application of it. So right back to you guys. You guys have been a wonderful partner, especially as we do internal compliance and bring out that tool, which is going to be helpful.
Didn't even talk about that.
That's
one of the mind share pieces that is really limited, that hopefully you guys can mature for people to consume.
And really grow. When a treatment center is trying to grow their staff and build uniformulaic process and structure through their industry in terms of where everybody's trained in their staff and levels of, and how they're entering into their own internal workforce, but do it in a way that is used and measured.
Yeah. Well, generally in our field, we know how to hire a clinician. Usually our organizations are filled with them. Hiring quality staff, technology staff, quality as in quality management, marketing staff, building and grounds, finance. For organizations like Cumberland Heights, sometimes the mind share that we lose when generations turn over an organization is hard to defend, that institutional knowledge. And so when I think about y'all's, I think about it like a SME center, subject matter expert center. You know what I mean?
Yeah.
And kind of like, here you can dip your toes in some sort of beginner, intermediate, and advanced themes.
Yeah.
So we're excited about that. If you want to learn more about TPN or Trevor, we're going to post his contact information and their organization in the episode, as we always do. Be sure to like, follow, and subscribe. We appreciate you guys for listening. Thanks again. See you next time.